So the other part of class that we're going to go over is nursing theory. You all should be getting a little bit of ideas about nursing theory as you all are looking at different theorists, working on your poster presentations for your project next week. So a little bit into nursing theory. Nursing theory is actually a way to view a phenomena. It's an organized set of ideas and concepts that help find meaning in experiences. It's a way to organize our thoughts and also to develop new ways to do what we do. As nurses, we have different processes that we do every day, and nursing theory can give us ideas of new ways that we can do certain processes. Why do nurses use theories? It gives us a guide to help with our assessments and assess different problems. We can help to identify different problems, help predict human behavior. Certain components of a theory. We have a phenomena, which is your actual subject matter of a discipline. When used in this case, it's often talking about phenomena of concern. So think about marking boundaries of a discipline, making one discipline more unique than another. We also have assumptions. Assumptions are your presumed ideas that don't get tested. Concepts, we've got the mental image of a phenomena or a certain subject. It's helped formed by generalizing an abstract idea from your experiences, looking at different observations of your events, and kind of exist as a symbol in your mind. We also have definitions, which is your meaning, also maybe generic, general, or specific. And then we have statements and propositions. These help describe linkages among the concepts of a theory. So in looking at theories, we can actually look at, is it a theory, is it a model, or is it paradigm? A paradigm is actually going to be a worldview of the ideology. It's a way of thinking that's shared by a community that are studying, working on the same type of phenomena. The conceptual framework, that's a set of concepts related to form a whole. And they tend to be broader, more philosophical than your actual theories. Then we also have your models. Your model is going to be a symbolic representation of the framework or concepts. Sometimes your conceptual model can be referred to that way, and can also be expressed in symbols, a different language. So how are these theories actually developed? Who comes up with them? Where their thoughts come from? Typically, a nurse has an idea to explore this theory through research. They have an idea in mind and they decide that they're going to start researching and getting information to help gather their research. There's two different types of reasoning that they use to look at this research. We look at inductive reasoning. That's helping to bring in, so think inductive in, info to make generalization about this idea. It's specific to general. So you're gathering separate pieces of information in a pattern to help form a generalization. Think induction, bringing in ideas to make the generalization. Deductive reasoning, this starts with generalized reasoning and then deduces it. It's more general to specific. Your information, so when we think about inductions and deductions, they're not facts or truth, but rather they point you in the direction to go as far as seeking your truth. They're going to allow you to make connections between ideas when you're helping to develop a theory. So question, the nurse notes that his patient has pitting pedal edema, crackles, and an elevated blood pressure. He concludes that the patient has fluid volume excess. This is an example of, and when we think of inductive reasoning, bringing in information, deductive, starting with generalized reasoning, then deducing it. So out of these, which one would it be an example of? Your actual answer is going to be B, inductive reasoning. You're helping to bring in information. You're involving drawing a general conclusion from a pattern found from certain individual pieces of information. So as you see in the picture, inductive reasoning, we're looking at the patient. We see elevated white blood count. We have temperature. We have a wound, has red and oozing pus. We can conclude and start to think in our minds, maybe the patient has an infection going on. Whereas on the other side of that, deductive reasoning, I'm looking in my thoughts. I know that the infection causes elevated temperature, white blood cell count. The patient has a diagnosis of kidney infection, and then I'm concluding I'm going to monitor the temperature and white blood cell count. So in a way, I'm kind of going backwards as where my thoughts are. I'm going general to specific. So just to touch on different theorists, these are most commonly some of the ones that you all are looking at for your poster presentations. But just to kind of touch on a little bit about what they are most known for and what contributions they've made to healthcare. So Clara Barton. Clara Barton was actually most famous, most known for her place in the Civil War. She was a Civil War nurse and actually founded the Red Cross. The Red Cross, American Red Cross, is still around today. They help in a lot of disaster situations, and it's a very well-known organization. Dorothea Dix. She's most known for her contributions to the mentally ill, developing mental institutions, mental asylums, and just her work with mental illness and contributions in the mental health care. Florence Blake, she's more famous in the pediatric world. So if you decide to go into pediatrics, you may hear a little bit more about her. She started looking into family-centered nursing care and just made a lot of contributions to pediatrics. Of course, Florence Nightingale, we know, is the mother of nursing. She contributed a lot to nursing and healthcare. She looked at clean environments, making sure that environments were healthy, that patients had clean food to eat, and just overall improvement of sanitation of the area. Florence Wald, she's known for her contributions in hospice, actually the founder of the first hospice program. Linda Richards, she is one of the first professionally trained nurses to become a nurse. Margaret Sanger, she's known for her contributions with birth control, being a birth control activist, sexual education, and she did some work speaking about abortions as well. Mary Breckinridge, she is a famous midwife. We talked about her a little bit in the beginning of the semester in her contributions around Frontier Nursing Service. She was a midwife that actually served in rural areas of Kentucky and rode around on horseback and is famous more so in that rural area. Mary Seacole, she's a famous war nurse around the Crimean War. And then Virginia Lynch, she's famous more in the forensic nursing world and is a forensic nursing founder. Hopefully some of you all have chosen one of these as your theorists for your poster presentation, and we'll get some more ideas about them, and you can teach some of your classmates a little bit about some of these major theorists. Again, Florence Nightingale, we really look at her as far as the clean environment, making sure that patients had healthy food, and the pre-germ theory. Virginia Henderson, she's known for Nature of Nursing. She described a nurse's function, identified 14 basic needs. If you look at box 8.2, it's referring back to your textbook if you have the fundamentals textbook. Patricia Benner, if you ever get the opportunity or you want some extra reading practice or something to read good over the summer, she actually has a book, and it's very good to read, very good material that talks about being a novice to expert nurse. And it just talks about the process as you're growing in your healthcare world, you're growing as a nurse, and how you become a novice nurse from right out of school or right as you're training to be a nurse, and how you become an expert nurse. She looked at the caring model and how caring helps nurses connect with patients, and then just overall growing that happens in your nursing career. Madeline Leninger, she developed culturally competent care. Rosemarie Parse, she looked at a person's life and how it's ever-changing, and personally defined it through one's own perspective of a goal. And then Dorothea Orem, she looked at the self-care deficit. Nurses care for those who can't care for themselves. So the nurse incorporates Hispanic beliefs about hot and cold into her plan of care for her client. The nurse is providing care based on which nursing theory? It would be D, Madeline Leninger. Her work focused on transcultural nursing and developing cultural competence. So as we look at Maslow's hierarchy of basic human needs, this theory identifies 8 different levels of needs and identifies that lower level needs must be met to some degree before the higher needs can be met. So if you look at the bottom tier, physiological, food, air, water, temperature, physical activity, we must meet these goals based on Maslow's hierarchy of needs before we can start to meet these goals as they move up the pyramid. So before we're really, moving up to love and belonging, we have to make sure that they're eating, they're not hungry, they have water, they have temperature regulation, we're keeping them warm. We have to focus on these at the bottom before we can really achieve these at the top. I would encourage you to click the link and watch the video about Maslow's hierarchy of needs. Again, looking at Maslow's hierarchy, when we look at basic physiological needs, the respiratory effort, cardiovascular health, food, fluids, nutritional intake, we have to look at those before we can get to safety and order and control, preventing injuries, safety, building trust between the patient and the medical staff. And then love and belonging, ensuring adequate support systems are maintained, being empowered and valued. We have to reach these in a logical order before we get to the top of the pyramid. So in looking at research, there's different types of research that can be done. You'll have a whole nursing course on research as you get towards the end of the program. But to give you an idea of how research is conducted, we have different research designs. So quantitative and qualitative. Quantitative research generalized to populations. We're gathering data in order to best generalize results to a similar population. Main purpose of your quantitative research is to gather data from enough subjects, which are your people being studied, to be able to generalize the results, making you think, what I found to be so for this group of people will probably be the same for all people who are similar. Think quantitative, you're going to think numbers. Qualitative, we're not thinking numbers at this point. That's more of your opinion, experience. Your research is more focused on lived experiences of people. We're gathering data by interviewing real people about a certain experience that you're interested in studying. So a nurse researcher who intends to interview clients about the factors that influence their compliance with insulin therapy and summarize the data as themes is doing quantitative research. That one's going to be false. Data in the study would come from experiences of clients living with diabetes as they can relate to information to the nurse researcher. The data was collected during an interview with a client, therefore it's qualitative. If we were thinking numbers, that would be quantitative. The steps of the research process. First, we're going to begin with selecting and defining the problem you wish to study. The big focus here is evidence-based practice. Evidence-based practice, we're looking at the why behind what we are doing. What is the best practice for the reasons of why are we doing this certain thing. When you're doing the research process, you want to select a research design. We're going to collect data, analyze data, and then use the research findings. So, participants that are involved in research have certain rights. They have rights to informed consent, right to not be harmed, right to full disclosure, right to self-determination, and then right to privacy and confidentiality. So your right to not be harmed, information is given to the participant about the safety of the study. They shouldn't be harmed, should indicate if there is going to be any harm to the participant, then the study would be stopped. Right to full disclosure, we're going to make sure to give them all the answers to any questions. They should know the purpose, they should know the risk, are there any benefits, are they getting paid? Right to self-determination, they have the right to say no. At any time in the study, they have the right to stop participating. So as the nurse, you are kind of like a support person, and you can educate them on that. They have the right to say no. And then your right to privacy and confidentiality, obviously, we're keeping information confidential, keeping data, confidential that they confide in us. Your institutional review boards, you will hear this called an IRB. It must be approved by your institution before you start your research. Most of your hospitals, universities, they are involved as an IRB. And they have to review and, approve your request to research and approve your project that you're going to be researching. So whenever you begin research, you're going to develop a question to help guide your research. So we call this a PICO question. So PICO actually stands for your patient population. This is going to look at the characteristics, age, gender, ethnicity, the population of who you are studying. I is your intervention. That would be what you were looking at researching. Is it a drug? Is it a surgery? Is it a policy that we are looking at? The setting, it's the intervention that we're looking at changing or looking at the research behind that intervention. C is your comparison. What are we comparing it to? Are we comparing it to not doing this procedure, or are we comparing it to what the common practice is? We're looking at some sort of comparison. And then O is outcome. What your outcome of what you hope to achieve. And then T, sometimes you will see T added on to the end of that as well, and that could be the type of questions or type of studies. But all of your questions, whenever you are starting research, you're going to start with this PICO question to help guide your research that you are looking into. So as we are completing our research, we're also going to be analyzing our research and looking at different research articles, studies that have been completed. We're going to look at what is the book, journal, article about as a whole. So if we're looking at this particular article based on this research, what's the theme? How is it developed? What particularly is being said in detail? What are the author's main ideas? What are their arguments? Looking at the abstract, looking at the conclusion, and looking at the overall thoughts of that article. You're going to look at, is the book, journal, article true in whole, or is certain parts of it true? You're going to use these articles to help guide your research and to say, do I have research to back up what I'm wanting to change or what I'm wanting to look at? And then, is it significant? Is there any significance of the research of the article or the book that you're looking at? Is there any way to use that information to help improve patient care? Because when you're doing this research, a lot of times you're looking at a specific problem and looking at, how can I make this better? Is there any way that I can use this information to improve this patient healthcare problem? So there's different levels of evidence that you can use. Level 1 is your experimental study, randomized control trials. Level 2 is a quasi-experimental study that's more of a systematic review, can be with or without a meta-analysis. Level 3, we also have systematic review. It's a non-experimental study, qualitative study, or it can be a systematic review with or without meta-analysis. And then it progresses on to level 4. We have an opinion of respected authorities and or nationally recognized expert committees. Level 5, this one's based on experimental and non-research evidence. Could include literature reviews, quality improvement, case reports, and then opinions of nationally recognized experts. So research utilization, the reason we're conducting research is to establish evidence-based practice. Asking is always the answer. We always want to know the why behind what we're doing and how we can improve to make sure we are doing the best protocol or whatever our intervention is, that it is the best for patient care, that there's evidence that has been done, evidence that has been studied, that we are doing the best evidence-based